Okay, so we've heard about mothers who complain about the workplace is not giving them maternity leaves, or maybe giving them very few days for maternity leave. Yet from this discussion, I believe it's actually essential for a mother to take some time off this pressure, this kind of work, to recover from this whole state of pregnancy. What do you advise and what do you think about that? And then the other question I want to ask about is, we would love to know when a mother can actually get back to their normal kind of life, or maybe a mother who likes heels, or maybe doing these other house chores, be it a mother of cesarean section and or normal delivery.
Okay. So first of all, giving a mother leave, it is very essential. Very essential. To a C-section mother, first of all, we first allow the body, without trying anything, these things of exercises that physios give us and fitness experts give us, at least we need to first give the body like 6 weeks for a person who has given birth by normal delivery. 6 weeks. That's just for the body to recover by its own self without helping it.
That's like a month and a half, eh?
Yes, just like a month and a half. Okay. Then there is what we call supported recovery, where maybe a fitness trainer can come in or a physiotherapist can come in. So that can also take on for like 1.5 months.
Okay.
So if you put it in general, it can be like around 3 months, which actually most of the companies give. But unfortunately, some companies don't give.
True.
Yeah. Now, cesarean section, at least 8 weeks. That's when we allow the body to heal by itself. 8 weeks.
Okay.
Then supported recovery after 8 weeks.
That's cesarean section.
Yeah? That is cesarean section.
Okay.
Now, why do we give these supported like recovery systems or all the exercises that we do? Some mothers actually go on YouTube, Google, like they search over exercises to help them come back. Now, some mothers want to lose the belly. That is their main thing. Lose the belly, lose the weight. But the general thing of recovery during the leave period, it is actually prepare the body for the work ahead. Okay. That is the essence of a leave. Allow the body heal for the first 6 to 8 weeks by itself, then support it with this recovery to prepare it for the next work. For example, for someone who is going to the office or any other thing that they are doing. Also, the purpose of this leave too, it is also to bond with the child, breastfeed them, all that you get. So now this mother, after the 6 weeks or the 8 weeks have elapsed, let them do their fitness exercises. First, to strengthen the back and to strengthen the tummy.
Yeah.
Because every work that we do, most of us, all of us, use the back, use all these muscles. Even if they are legs, even the legs, even the arms, we use everything. So we need, because when these hormones are affecting our bodies, they don't affect only only a particular group of muscles. It affects the whole body. You may find even some of them swelling in the face, whatever, taking back everything. So what we have to do is support them. These exercises are preparing you for the work ahead. For example, if your work requires you to sit a lot, that means we need to have the abs and the back more, because they are the ones which are working more. Now, if your work requires you to do a lot of hands, using a lot of hands, now the salon ladies, the back and the hands, we need to still exercise these muscles to be strong. Okay? So all these things are helping to prepare the mother for their job. Depending which job that they have, they do exercises according to what their job requires. And also the other thing, also the purpose of this leave, it is to also prepare the baby. Some mothers wake up one day, tomorrow is work, they leave the baby that very day when they are going to work the following day. So I realize these mothers will have anxiety, that guiltiness of feeling, Mananga, you have left my newborn at home.
Every minute
you're always thinking about the baby. And now imagine your boss is pressurizing you. Remember, you didn't get enough time if you did not exercise, actually, right? You did not get enough time for your body to recover very well. And now your boss is putting pressure on you that you need to bring results. And then you're thinking about your baby that you left at home.
Sure.
So what do we do in this leave? Prepare your body, prepare the child too. Prepare the house help at home,
Sure.
who are going to take over when you're not there. So once you know that everything is okay, now especially in the last month, let me say the 2 week, to leave alone the 2 months. Now that third month, or maybe if they give you 2 months of leave, so that last month when you're preparing to go, work on yourself, prepare the baby. If it means just leaving some hours, preparing the baby, be like, now today, usually I go to work at 8. So now I'm going to leave at 8, I'll come back at 9. So the baby knows, okay. Then the next day you'll be like, I'm going to go from 8 up to 10.
Sure.
You're preparing, yeah? Even the baby is learning how to bottle feed.
How to do it.
Now, by the time you know it, you're pushing to the hours that you work at work.
Sure.
And then by the time the baby, you begin work, everything is okay.
Yes.
You're also used, you're also,
Sure.
So the other thing you asked about the heels. Now that one, if you do not have any predisposing pains, that are the ones that we talked about, at least after the first 3 months.
Okay.
Because when you're weak, you can feel it in your body. Always listen to your bodies. You can feel it that, if I put on this heel, I feel like I'm not steady enough to walk like more than 20 steps. You can feel it in your body. But I would suggest that 3 months and ahead at least.
Okay.
Yes.
So literally, you'd advise a maternity leave to take 3 months to 4 months. 3 to 4
if
months.
possible.
Okay.
And also putting on heels, yes, at
Yeah.
least 3 months and 4, yes.
All right. So Sharon, have you been able to talk about this back pain, this pregnancy pain, mother postnatal pain to communities, to people? Do people actually know this knowledge from you about all this? And if yes, when did you start? When did you actually get interested in finding out more about mothers and how they can manage this pain?
Yeah, so yes, I've been able to talk about this back pain because I realized it hurt me so much, to the point that it cost me my job actually because of that bad back pain. So I was like, why would someone wait to have this back pain and lose their job, yet they can do something about it? So from that time actually, when I had my first child, that's when the passion came about in helping these mothers and ensuring and come off with these themes like myths that we have around with care of mothers, pregnancy and after giving birth. So my journey started from there. So I started first of all to work on myself, to get to know, okay, how are these things going to work upon the ones that we are going to talk about? Yes, we studied them in textbooks. Practically, are they going to work? So I started with myself. With my second pregnancy, I started to incorporate whatever I wanted to teach someone. I started to incorporate it myself from the time of pregnancy of my second child and until when I gave birth to her. So after giving birth to her, during the pregnancy I did everything, and then I got the competence. I was like, okay, now this is doable. Then I started sharing it with the friends, with those ones who are pregnant around me. Yes, I was in a setting, of course, when you're studying things in textbooks, you tell a patient, you try to avoid. But when you've not experienced something, you cannot understand the depth of it.
True.
But now, after giving birth to this second child, and I tried these things were working out, now the clients that I was meeting, yes, before I was meeting clients that were pregnant and those who had given birth, I was helping them according to the textbooks
Using
that what we
theoretical
learned
knowledge.
in school. But the ones that I saw after giving birth to the second child were out of experience.
True.
So I met these in clinics. I talked to them, how to care for them. I shared my experiences with them. Even these ones, my friends around me, those ones who didn't have the money, I could go out to them, tell them, no, let me come and see you. So I had sessions with them like that. Then I started out sharing it out on social media and all that.
I'm booking you for my first pregnancy.
Of course, you are my client then.
All right, that's all. What's that one message you can leave with our mothers who are expecting, or the pregnant ones, or maybe someone who has just given birth and they have not yet had the pain, but maybe they have the warning signs like you told us? One message you can leave with them as
Yes, first of all, what you have to know, you have one back.
Okay.
You're not going to get a replacement. Yes, they try to give us the surgeries and whatever, but you cannot return back to the way it was after surgery. So that means we have to take care of it. That is the first tip. Then the second tip, all these people that you're trying to please, whether at home, over what,
Oh,
their
man.
backs are okay.
My man.
My man, I'm doing this for my man, I'm washing for him, I'm doing this for my man. His back is okay. Yours, it is struggling. Now imagine, you just have one. You have more to give birth to.
True.
So that is the other thing that you need to note. First of all, love yourself. Think about that one back, others, their back are okay. Then the other thing that we need to note is listen to your body. Wherever you feel any discomfort, tending to pain, report to the health worker to help you out.
Okay.
At least they will give you the right help that you need.
Okay.
Yes, that's what I can say.